Go.
Hi, my name is Savannah, and this is my second NG-tube demonstration video. So before entering the patient's room, I would have verified provider orders for the NG-tube. I would see if the patient has any allergies, and I would also see if the patient had any recent trauma to their face or history of trauma to their face, nosebleeds, etc. I've also already provided privacy for my patient, performed hand hygiene, and donned on my gloves. So here we go. Hi there, my name is Savannah, and I'm here to do your nursing care today. How are you doing? Good. Okay. Could you tell me your first and last name and date of birth? Okay, perfect. Thank you. Okay. So today we're going to be doing your NG tube. And so this is for feeding. So since you haven't been getting the nutrients that you needed and you've been throwing up, this will help with all of that. And so I've lifted my patient up to my height so that I can work with him the best. Okay. So do you have any known allergies? Okay, and have you had any trauma to your nose or face or history of nosebleeds? Okay, good. All right. So first we're going to start. So before doing anything, I would do vital signs for the patient just so that we make sure that we're at a good base point, and since their vital signs are all within normal limits, we can continue with the procedure. Okay.
Here we go again.
This is to protect you in your gown. And then this is just in case you need to spit or anything during the procedure. I'm going to set you up just a little more. Okay, that's about good. And so for this water, I'm just going to have you take a sip real quick. Okay, and then can you cough for me? And so that's to make sure that the patient's reflex is all intact and everything. And so during this procedure, we're going to start by tilting your head back, and we're going to be putting the tubing through your nose. And then once you feel it hit the back of your throat, then you're going to lean your head forward, and then you're going to take lots of sips of water, and then we're going to get it through down the rest of the way. Does that make sense? Okay, and so when it does hit the back of your throat, there's a potential that you could feel some gagging, and so that is why I'm going to provide you with a napkin just in case you feel like you need to wipe your tears at all. And so since this is a uncomfortable procedure and it may cause some discomfort to your nose and your throat, but are you in any pain right now? Okay, good. All right, so here's all this for you. And so before getting started, I'm going to get the tape ready for the patient. Okay. All right, there we are. Okay. Now we're getting the tubing ready. And so to start, we would be measuring the tubing to see how far it needs to go. So we're going to start measuring by going from your nose, the tip of your nose to your ear, which is about 15 centimeters. When I'm 15 centimeters in, that is when you're going to come forward and start drinking. And then we're going to go from that 15 centimeter mark to the xiphoid process, which is roughly 55 to 60 centimeters, and then you would add just a little bit to make sure that you're getting all the way through. And then for these mannequins, it's about 45 centimeters. Okay. Alrighty. And so for the lubricant, we're going to put it about 2 to 4 inches to make sure that it's more comfortable for the patient. I'm also going to double check to make sure that it does not need to be diluted, which it does not. And I'm going to check the administration rate, which is going to be 1 minute for the patient in the IV line. So for a male patient, okay, so again we're going to start with leaning your head back, and then we're also just going to check to make sure Oh, and then before doing this, I'm going to have the patient plug each nostril. And so when you plug each nostril, you're going to breathe through each and see which one's easiest to breathe through. And so whichever one is easier to breathe through is the nostril that you're going to do. And then I'd also check to make sure that there's nothing else wrong with his mouth or nose, etc. And so for demonstration purposes, we're going to say that it's his right nostril that's easiest to breathe through. Okay. Alright, ready? Oh, and then also when I measured it, I would need to mark with the marker or tape at the 55 centimeter mark, but for this patient it's going to be about 45 centimeters. So yeah. All right, now we can proceed. So to 15, and then lean forward and drink your water. Drink your drink. You're doing great. Doing great. And we're done. Okay. Are you doing okay? Okay, so if the patient was starting to cough or feel intense pain, we would remove it immediately just because that could mean it's in their airway, which is a problem. Okay, and then I could provide some skin barrier just since we're putting tape on the patient to prevent any damage to their skin. And this is just temporary until we confirm placement.
Hi, my name is Sheila McKenzie. I'm the student nurse here with you today. I'm going to be administering your promethazine hydrochloride for your nausea. Can I go ahead and verify your name and date of birth? I will put everything down, make sure
Noticing that we have a 1-inch border.
make sure it's in sight.
Okay, and then this would be secured better after confirming placement as well.
Before I check the
And so now I can secure the tubing to the gown as well.
Go ahead and verify your name and date of birth first.
We'll open it in slots.
Identifier here. And then please start going.
And so to confirm placement, you could first check for gastric content to make sure that it's the color that we're looking for, the pH that we're wanting. And then after that, we would go get an x-ray to confirm that it is in the right placement. And then that would be when we'd be properly securing the tubing to the patient's mouth. And so at this point, I can help to wipe my patient's nose and mouth. And I would also, but before that, so I would need to do hand hygiene and put on a new pair of clean gloves. And then at that point, I will be providing oral hygiene to prevent any infections or etc. So yeah. And then I will be continuing to clean up all of my materials for the patient. And I would be doing any education needed, so I would educate the patient on if the tubing is starting to become loose and out of the nostril, that the patient needs to report it to the nurse immediately. I would be reporting that if the patient starts to feel intense pain or if there's bleeding, that they should let the nurse know as well. And then for documentation, I would be documenting basically everything that I did for the procedure. So the size of the tubing, which nostril it's in, how the patient tolerated it, pH, the secretions, how I secured it, how I confirmed the placement, that I performed oral hygiene, etc. I would be documenting all of that, which you will see in my documentation later. And then for putting the patient back into position, you would keep them at an upward angle for the time being, but lower them down to a safe level still. Make sure their call lights near them and that the bed is locked. And then I would just continue to dispose of all my materials as the facility says, and then clean up. And then now I can take off my gloves and perform hand hygiene. And that is the end of my video.